Are you thinking about Vyvanse for binge eating disorder, but you have questions about side effects? If so, this video is for you. Are you confused about your weight? Do you have questions about weight medicines? And do you want medically based answers to your weight questions? If so, you are in the right place. I'm Dr. Megan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is important because I actually prescribe these medications. I talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. Today, let's talk about the side effects from Vyvanse. So, like I've said in another video, Vyvanse is a very, very helpful tool for binge eating disorder, but it is not for everyone and you don't need it. Vyvanse is not a joke. It can have serious side effects. And so with all central nervous system stimulants, which is the category that Vyvanse is in, there are some very serious side effects, which include, but are not limited to, increased heart rate, blood pressure, heart rhythm issues. There's always the theoretical risk of stroke, heart attack, and death. Also, it's important to be on the lookout for behavioral changes. So someone might feel like on this medication, they're more anxious or agitated. They have issues with their sleeping. They might feel like they have more aggressive behavior. And then, in rare circumstances, this can kind of trigger mania or psychosis. Also, there's a risk of serotonin syndrome if they're on another medication that would predispose them for that. Dry mouth, sweating, and then the good old GI side effects, nausea, vomiting, diarrhea, constipation. They could have abdominal pain. I think I've really sold everybody on this medication, but this isn't to scare you. It's just to say that if you're thinking about these medications, these are the other things to watch out for. It doesn't mean that nobody should take this. You just want to be aware of the risks and the benefits. And always when I'm talking to somebody and I start them on this medication, I'm feeling like the benefits are far outweighing the risks. And we may, we're always going to recalculate that as time goes on. I think we're all, we hear about ADHD medications so often in the media that sometimes I think patients have a kind of casual idea about them, but this is a serious medication. It has serious side effects. And that's what I want you to be aware of today, of the possible risks, and have a good discussion with your physician if you feel like this might be a good fit for you. And as always, the side effects today don't encompass 100% of all the side effects that somebody might be predisposed to. So it's always good to talk with a physician who's well-versed in treating binge eating disorder, well-versed in using this medication for that purpose. It's a serious medication with serious side effects. It's a controlled substance. So there's state rules about when you can pick this up, how often. It's monitored much more carefully as it should be. And it's a lifelong medication. So whomever you're seeing, you want to make sure they're qualified to prescribe this and have experience of prescribing it, or they can refer you to somebody who does. And as always, it's definitely not the first step in treating someone with binge eating disorder. There are so many different tools to use when treating binge eating disorder. This is one tool, but it's not going to be for everybody, and you definitely don't need it. That's going to do it for today. Thank you so much for watching. As always, my references will be listed down below. If you want to work with me directly, you definitely can. I'll leave that info down below. Thank you again for watching, and please be well.